Good morning, I'm Armstrong Williams. Boy, October soon will pass us by and November will be here. Okay, so Congress passed, well, they didn't pass. Pelosi and her members of Congress, those that she was able to manipulate and browbeat, were able to come together on a health care plan, which they're presenting to the American people. I want you to bear this in mind. The document is probably 6 pages short of being 2,000. That's right, it's about 1,994 pages. They have 72 hours to read the documentation. I mean, I read books, books, books. And I will tell you, no member of Congress is going to read those documents within 72 hours and digest it. Okay? Not at all. It's just not going to happen. And so, who are they kidding? But here's the bottom line as far as I'm concerned. Listen, imagine if you're a surgeon or a physician, and the Hippocratic Oath of Medicine, of course, is first do no harm. You have a patient who have a catastrophic uh, issue that needs to be operated on immediately. The patient is at the hospital. Doctor's about to put them on the operating table. They hear from the insurance company. They say, "Lo, we need to get another opinion. If you perform this procedure, we're not going to pay for it." If you're a doctor, what are you going to do? I mean, are you kidding me? You think you're going to leave that patient and abandon that patient? And doctors make those kinds of decisions every day. The decision is to save that life, to do as much as you can to minimize the pain that the person is enduring. And then for some families, after the procedure is over, they get a doctor's bill at the tune of $500,000. I mean, since when did insurance companies have the role of deciding who and what, when and where get what procedure? That is a problem. Insurance companies should not be in the decision that should be solely between the physician and the patient. We have to minimize the role of insurance companies in this debate. And also, listen, I am one who Saturday through Wednesday, I'm at the gym, especially during the weekday. I'm there in the wee hours of the morning, 4:30 a.m. in the morning, exercising. And then in the evening and throughout the day, I watch what I eat. It's not easy.
It's 6
There are a lot of
o'clock.
things I would enjoy eating, but I just don't. Because listen, until we get into preventive care, where people are eating properly and exercising to deal with diabetes, to deal with heart attacks, to deal with strokes, to deal with high cholesterol, not much is going to change. There must be a discussion about preventative measures for everyday Americans. Do you know that 40 to 60% of healthcare costs happens during the last the 4 to 6 months of a person's life? That's right, 40 to 60%. We can't not be poking and punching and prodding people. People should be able to live their life out and die in peace and let nature and let God just take its course. If it's a person's time to die, they will, and if not, they will live. But we must have those kinds of discussions. I mean, you're spending 40 to 60% of healthcare dollars in the last 46 months of a person's life. I mean, listen, we have to revisit these subjects and have a discussion in order to come up with a healthcare plan that works for all Americans. I'm Armstrong Williams, something for you to think about, and please enjoy the rest of your weekend.